Yeah, Richard May here. So I want to commend you and your team there for trying to come up with specific alternate things rather than just saying no to what the other team is doing. So that's always good. And I see some merits in some of what you're coming up with your plan you were showing earlier. But a lot of what you're proposing there hinges on letting the marketplace work itself out, and I think that there wouldn't be anybody demanding or asking for a single payer system nationally if they could get cheap health care. And I think what happens is that there's something that seems similar to price fixing going on, where there isn't a cheap guy. There isn't some health insurer coming out with a lower profit alternative, like the way currently right now with pharmaceuticals, you can go to Walmart and they're actually undercutting and getting rid of that $20 an aspirin plan, and they're coming out with the generic versions. But there doesn't seem to be for regular health care those kind of options. And I'm wondering, I mean, sure, in this state you're asserting that we're down to very few providers because of the regulations, but even in other states where there's a lot of different providers, they all kind of price fix all at an amount that's the highest paid in the world. You know, more than people pay in other countries. So you're basically entrusting to the wolves to look after the chickens. And can you tell me what could be done to make sure that the competition actually takes place and somebody actually offers healthcare at a lower cost as a result of letting the market figure itself out?
Gotcha. What's interesting about that comment, because when I look at my plan, I think I get exactly what you're talking about in terms of bringing the competition and lowering the cost. Right now, we have to realize there is no unregulated system in our country. I mean, it's already heavily regulated. And so we talk about the massive increases, and are these insurance companies sticking it until they get to the state? Well, the 17% increase that Commissioner Kreidler approved was approved by Commissioner Kreidler. He said they could show their costs have increased by that much. What's driving costs are a lot of the government rules and regulations that prevent you from having these different options. The certificate of need example I give you in Washington State prevents people from coming in and competing with the monopoly, so you can't have those options. It's basically prevented to have competition under the current system. I got a great article emailed to me today that showed in Kentucky, I believe it was, a 25-year-old male could get a health care plan for $896 a year. In New Jersey, that same plan costs $5,600. So I do see in different states quite a variation in terms of cost of the health care insurance that's going on out there. So I think we haven't tried the competition track, and so I think we should give it a shot. We haven't passed code reform, we haven't passed certificate of need repeal, we haven't gone out and encouraged insurers to come into our state. And so I think before you turn the system over, you try to address those cost drivers and give people the options. And if it doesn't work, then you come back. When I first put this plan together, I was toying with the idea of an individual mandate that would go into place in 2016. So I got shot at by all these people who said, you can't have an individual mandate. But the reason I want to do an individual mandate is it would come only after we had implemented all these reforms. And so we could come back in 2012 and 2013 and test it and say, is it working? Are we actually getting all these people onto the insurance rolls? And so are we shrinking that 12% down to 3% or 2% through what we're trying to get accomplished? And the other part of my individual mandate, just to let everybody know, was an opt-out clause. You could sign up and say, I don't want to be in it, so you could still have an opt-out from the individual mandate. But to test it and say, do these reforms actually work of getting more people insured and giving them more options and breaking down those barriers? So I hear what you're saying. Does this plan get us all the way there? There's lots of other stuff we don't have time to go into. How I treat chronic disease. Dr. Lynch here in Washington County has gone through this Pursuing Perfection grant, which can save us lots of money if we invest some in terms of helping people on chronic diabetics how to get their constant treatment. Lots of other ideas we haven't gone over tonight that are also innovative ways to deal with healthcare. But the first thing you have to do is contain the costs and fix some of these things to get the competition. Allow that, which is the great American way, to happen here in terms of the competition, and you keep helping out our healthcare systems.